everyone, welcome to Monday Night Live, and I'm very excited tonight. We will be talking about male factor infertility, which is so important and often is neglected. And we're going to be joined by the infertility man tonight, who is going to tell his story. Hi everyone, and his partner's story. And there's Infertility Man. I'll just wait for him to ask to join us, and then I'll accept him. So Jon has been a patient of mine for a long time, and he's going to join us now. And he's on Instagram known as Infertility Man, but we should be calling him the Fertility Man now. There's Jon. Hi, Jon.
How you doing? How are you, Lynn?
Great. And so thank you for joining us tonight. And I actually had down as the post to talk about male factor infertility, and I thought, well, who's better to join me but you, because you're so open about your journey, and you're sharing it with people, which is a marvelous thing. Because if you ever meet Jon in person, how tall are you, Jon? Like 6'4" or something?
Yeah, around about that, yeah.
And you're like a big muscular man, a masculine man. So so we don't often associate that like with infertility, but it affects everyone, doesn't it, Jon?
Yeah, that's correct. I think there's a lot of guys out there. And that affects the women as well, but there's a lot of guys out there who aren't talking about it and would benefit, I think, from the support. And I think the biggest thing is you're not alone. That's the biggest plus, I think.
Well, when we do see an infertile couple, so to speak, 40% of the time it is due to male factor, 40% female, and then the other 20% is a combined between the both of them. So it's actually 50% of patients will present with male factor infertility. So it's very common, and it's great that you are talking about it. And do you want to tell everyone about where your journey began?
God, it was a few years ago now. Laura and I met, and she asked the question. Well, we were talking about kids, I guess. I guess you get a little older and you get a little wiser, supposedly, and you start talking about these things quite quickly. So she mentioned kids, and I said I'd love to have kids, but I can't have them. And she asked a very simple question. Well, is that really true? And here we are, I guess. I delved down the rabbit hole, and I went, right, well, there must be some tests that I can do. And yeah, it's been quite the journey. And I guess for me, well, we ended up with you, didn't we, Dr. Lynn?
And tell us about how, you were diagnosed with cancer was it 2011?
Yeah. That was that's correct. So 2011. So in the lead up to that, probably would have been 2010. I don't know. All the guys might know out there. Whenever you get kicked in the nether regions, it's this pain that you can't really describe, but you can't really shake either. And I hadn't been kicked there, but I just had this pain, and it was niggling and it was bothering me. And I guess if I can say anything to guys, just speak up and get it checked, because good old Jon, I put myself, I took about 2 months to go to the doctors and finally get it checked out. And that was basically because I couldn't manage it with pain relief. And at the end of the day, I went and saw the doctor. He did a physical examination, and he basically said it was going to be epididymitis, so just some inflammation of those tubes around the testes. And I'm like, all right, cool, that's no problems. And he sent me off. He said, best go for an ultrasound. So off I go for an ultrasound, and I actually knew the radiographer, or whatever you want to call him, and he asked me in, and that was when he saw that basically my whole right testy was a tumour. And
Oh, wow.
yeah, that was a surprise. He actually said, "Do you want to wait for me to write to your doctor, or do you want to have a look now?" And I said, "Oh, I'll have a look now." So he showed me, and yeah, that was quite a surprise.
Wow.
Basically, that was the end of the day, and then obviously you got the results to the doctor the next day, my GP. So that would have been Tuesday. Yeah, I got that news, and then Wednesday I saw my GP again, and he basically was on the phone to a urologist, and I was off to a urologist that the next day after I had some bloods and scans, and then yeah, I was
Yeah.
under the knife by the following Monday.
Well, that must have been a very terrifying moment for you to face
I
that.
tell you, I guess I was lucky in the fact that I didn't have much time to process it. I had enough time to get mum down from up in Queensland, and yeah, it was just a real surprise, a real whirlwind. So I guess by the time it was all over, I was trying to deal with what had happened, really.
Right.
And
Yeah.
when they removed the testing, they have to send it off for a test to see
Yes.
the type of cells that were involved, and
Yeah.
that was going to decide the chemo or the radio or radiotherapy that I would have had to have. And
Yes.
yeah, I guess I was lucky in the fact that the type I had would have been the lesser amount of chemo, but I had a really good oncologist, and he just sort of thought, well, look, I think we got it all. We're going to watch it like a hawk, and
Yeah.
we'll see if we can get by without the treatment.
Yeah.
So
And
I was scans and bloods for the following months and years. So yeah.
yeah, so yours hadn't spread. So even though it was a large testicular tumor, fortunately it hadn't spread.
They were watching there was a spot in my lung,
Wow.
which they had watched they watched for a while, and it didn't seem to change for about the first year. So whilst they looked at it for about the next 5 years, that didn't develop into anything. So it might have been something from when I was a child or something like
Right.
that. So if I could say, back when I was a baby, I found out through my mum that the hernia she spoke of when I was a kid was actually an undescended testy,
Right.
which
Ended up
if you
being
have a
the,
look at if you have a look at some of the stats, that's
yeah.
where some of the where a lot of guys'
Yeah.
issues start.
Yeah, yeah. So I think with undescended testicles, you are at risk of developing testicular cancer. And I was speaking to a urologist at work, and he's saying there is an increased number of men, young men, suffering from
Yep.
testicular cancer. So guys, you should do your self-checks regularly. And if you do have pain like John, please go and see your GP and get an ultrasound to start with. And if your GP won't do an ultrasound or any investigations, go and see another GP. Because you do
That's
need to
right.
get it out. And it's fortunate that yours hadn't spread, and that I think not having the chemotherapy was the key for you, wasn't it? Because I think if you had chemotherapy, that might have actually stopped any sperm production.
That's correct. And I think at the time, my doctor, what he actually said would have been, I think you're going to have to look at other ways to get pregnant. But what I heard at the time, because kids weren't really weren't on the table, I think
Yeah.
what I developed in my mind, or the story I told myself, was that I couldn't have kids.
Right.
So I guess that was how I put a bow in it and finish it, and I can put that in the back shelf and forget about it and not worry about it. So Laura really threw a spanner in the works there, but here we are. Hey?
Yeah. So then you met Laura, and Laura saying, okay,
Yeah.
well, I want to have babies. So then you went down the investigations on how to
Yes.
make a baby.
Yes.
And
Yeah.
you came to see me, and we did some hormones.
Yeah.
And you also saw Dr. Katz,
Yeah.
who
Yeah.
suggested the Micro-TESE on you rather than a small
That's
biopsy.
correct. if I can say, Lynn, just before that, I had so I did a sample and
Yeah.
did the old cup thing,
Yeah.
and I basically had no sperm in the ejaculate.
Right.
So big donuts there, and then my next step was onto a fine needle aspiration,
Right.
and we found one sperm, and
Right.
it was immotile. And
Yep.
Laura still talks about it now, that I was jumping around going, yippee, I found one. Where there's one, there has to be more. But
Yep.
yeah, she was going, they only found one. And I went, yes, they did. I didn't think I had any. So yeah, and then we ended up with Dr. Katz, because the Micro-TESE was my next option, purely because with only one testy being available for treatment, we didn't want to cause any sort of scar tissue, which may affect me potentially getting or producing sperm. So that was a big one, I think, and I had been on testosterone treatment as well, replacement therapy, which, as I realised, that actually affects the production of sperm. So I think there are a few. It was like the perfect storm. I had a few things going on, which was actually affecting my ability, well, to make sperm or get it out in one way or another. So yeah.
Yeah. I think a lot of guys don't realize that if you are low in your hormones and you take testosterone, it's actually like a male contraception. So that's why we haven't been able to come up with a male contraception, because if you take testosterone, it takes a long time to get out of your system, maybe a year to 18 months before the sperm will be produced again.
That's right. That's right.
Yeah.
And it did take some time for Dr. Katz to sort of, before we sort of progressed
Yeah.
with my treatment and what he prescribed. So and Laura and I had made a heap of changes as well,
And what
removing
health changes
plastics
did
and
you make?
perfumes.
Yeah, and I know
We
that you.
removed plastics and perfumes, and I was lucky enough. Laura was making them for me out of essential oils and stuff. So we were removing the stuff that was can mimic certain hormones,
Yes.
like estrogen and testosterone in men, which can affect the ability to make sperm.
Yeah.
So
And I
yeah,
think that's a
yeah.
very important point, because we are becoming more infertile, and a lot of it's to do with what we call hormone disruptors. And what you said about removing the plastics and BPA,
Yep.
and even your house cleaning products. Did you change any of
Yeah.
those things?
We pretty much went natural on a lot of the house cleaning products. It's amazing what you
Yeah.
can do with lemon and bicarb soda and things
Yeah.
like that. And
Yeah.
we sort of went to extremes. We removed a lot of the fragrances, stuff
Yes.
with any sort of fragrance in it, even the soaps and stuff, phthalates, and yeah, God.
You
The
cleaned
list
up.
is extensive, and I think you have to do the best you can, because I don't think it's possible to remove everything.
No.
It's just important that you recognise doing the best you can, and then just giving yourself a pat on the back, and then just keep putting one foot in front of the other.
And what about your diet? Did you change your diet?
Well, around that time, I'd actually decided to go plant-based. So
Right.
I was a big meat eater. There are a lot of animals who are very happy. I have stopped eating them. So I removed. Initially, it was a bit of a challenge. A year or so, I went completely vegan. I removed meat, dairy, and eggs. Fish as well. I removed it all and went completely plant based. And for me, I noticed some massive changes immediately. More so around the digestive system,
Yeah.
and being a shift worker as well. I really noticed my ability to get through night shifts and recover
Yeah.
enhanced.
So you cut out meat and you went more vegan. Did you take supplements as well?
I think for me, I did take supplements. I did. I made sure my protein. I had to have a look at the proteins that I was taking too. I was supplementing with hemp seeds and good natural nuts and with regards to supplements, I made sure my magnesium. I had a
Yeah,
good dose of magnesium. We looked at things like CoQ10, and I think basically the big antioxidants.
yeah,
We were just trying to remove the oxidative stress on my body, and if I did
yeah,
have any sperm, we wanted
yeah,
to make sure that they were one sort of alive, and two they
yeah,
sort of had relatively good genetic code. So we kind
yeah,
of hoped that Laura, not having any fertility issues, would actually get my sperm over the line with her eggs.
yeah. And you tried
Yeah,
oxygen. You went in the hyperbaric
yes,
oxygen chamber as well, didn't
yep,
you?
yep. Laura and I, we were both in the hyperbaric oxygen. We did about 60 hours each, and
Yeah,
the thing with it again comes back to removing oxidative stress, oxygenating cells that are actually that don't have the best circulation.
yeah,
And if you've got injuries or any sort of damaged sort of cells, then the hyperbaric actually helped get the oxygen to those deep dark places that weren't receiving the nutrients that they needed.
yeah, yeah. That's very interesting. We were going to do a trial on thin lining and hyperbaric oxygen, but we haven't
Yeah,
started that yet.
yeah,
But that's very because we have a lot of ladies with very thin lining, so we can't put their embryos back.
yeah.
That's very interesting. And so we've planned the micro-TESE, but Dr. Katz left that for a while, didn't he? So
Well, look, I think in our naivety, Laura and I thought we were just going to come to you, Lynn. We were going
yeah,
to get some eggs, get Dr. Katz and get some sperm out. Bam, bam, thank you. It's in and it's done, and we're done and dusted. And I can't recall off the top of my head now, but poor Laura didn't really respond that well
no,
to the medication. So
yeah,
again, we had to change our plan.
yeah,
We had to put off Dr. Katz, and I think at the beginning you mentioned that there was just it was just this magic number. We sort of needed at least sort of 20 eggs-ish to sort of give it a chance. If we found sperm, then we're going to end up with a couple of embryos, hopefully.
yeah,
And when we got that low number in the first
yeah,
surgery, it made things very real for us that this could take some time,
yeah.
and we just were forever changing tack to see what sort of result we can get with regards to eggs.
Yeah, yeah. So how many egg collections did Laura end up having? She had a lot, didn't she?
Well, for my first Micro-TESE, we did 9
Right.
um, to get, and I think off the top of my head we got 31 eggs for that
Yeah,
first Micro-TESE. And
yeah,
if you think about it, that was going to be it for us. Like
yeah,
the Micro-TESE is meant to be done once
yeah.
and once only. And basically, I woke up in my drugged stupor, and I see Dr. Katz with his little tadpole that he draws in pen, and he goes, "We found some," and I've just lost it. And but the biggest thing was he met me after, and he goes, "Well, John, we managed to find enough sperm for those 31 eggs, so we sewed you back up." And I'm like,
Oh,
"Oh, cool, that's great, we did it." And then he goes, "I believe you can go again."
oh
so
wow.
so for us that sort of moved the posts again, because Lynn, as you know, we were all set to transfer or do something with whatever we got out of that first one. So poor
Yeah,
Laura, I can still remember her face when she realised she had to do more egg retrievals to do the second Micro-TESE.
yeah. That's a
Yeah.
really tough journey. Tough and
Mm.
expensive and
Yeah.
exhausting and all those needles. Have you collected all the needles?
Yes, yes, they are
Yeah.
taking up a good portion of our cupboard right now. And
Yes.
yeah, I can't wait to sort of get rid of those.
Yeah. Yeah, like I would imagine you would have taken and all the different concoctions that I come up with as well. So
That's
to
right.
try and
That's
get
right.
the best number of eggs. So you had two micro-TESEs.
Yeah, yeah, yeah. I think we learnt a lot from all the changes we made with you, Lynn. Though you were always open to well, just seeing how our cycles went. But I think we all ended up coming back to the best of the worst, if you know what I mean. And we
Yeah.
went, this is the one where we actually got the most mature eggs or
Yeah.
most follicles and
Yeah.
mature eggs. So that that alone helped us, and those discussions we had in
Yeah.
collecting the eggs we needed, and that for the second Micro-TESE, we ended up with 48 eggs, I believe, from six
Wow.
retrievals.
Yeah, amazing.
So
Amazing.
so I think that was pretty special. We really started, but from then, once we found that one that worked, we just
Yeah.
stuck to it.
Yeah.
Yeah,
So
we
it's
just
pretty
stuck to
amazing.
it.
So then so we found sperm, we've got eggs and two sperm collections for you and we made great embryos. So that was great. Yeah.
Yeah, yeah. We did hope Laura would get me over the line, and well, at the
Yeah.
moment, yes, we've been very lucky. So yeah,
And we did a lot of that last year in COVID. So that was all hard. You couldn't come into the clinic with Laura.
yeah,
So that was hard
that's
for
right.
a lot of couples and not being able to come into the clinic with their partner to support their partner.
Yeah, yeah. I would drive up, drop her off, drive around for a little while, wait for her to stumble out, and then into the car again, and off we'd go.
Yeah, and I remember when we did the embryo transfer, you were on
Mm.
the little, I think we had you on FaceTime, didn't we?
Yeah, that's right. That's right. I was outside. I was
Yeah,
outside. The allergies were bad, Lynn. I could tell you. I was hard to control myself then. That was just a bit much for me.
yeah, no, and it's fantastic. And so you've announced on Instagram that you're pregnant, so that's fantastic.
Yeah,
Congratulations.
yeah, yeah.
Yeah,
No, thank
that's
you.
wonderful.
It's a blessing. We are completely beside ourselves. Every day we just pinch ourselves.
Yeah, yeah. I must admit, when I first met you and I looked at some of your hormones, I was worried whether we would find sperm.
Yeah.
So it's amazing that we found sperm. But that wasn't going to be your only option if you didn't find sperm. You were still going
No,
to, yeah,
that's correctly, and I think from our perspective, initially for me, when Laura asked, it was really important to me to have my own genetics. But from the initial part, I started to think about, well, the actual outcome we wanted was a family together, and we ended up doing some fostering courses and or a fostering course. We looked at we looked at the donor situation. So I think for us, in view that we wanted to make forward progress each time, that first Micro-TESE, because it sort of came up just before the COVID hit, we had decided that any progress is good progress, and we went, right, if this Micro-TESE doesn't find any sperm, we were going to be able to move ahead. And if we did find sperm, we were going to be able to move ahead. And be that to donor sperm, or be that with the embryos we make. So
yeah, yeah. And that I think that's important for there are options. I know
yeah,
donor sperm in Victoria is very limited.
yep,
With the I don't know whether how you investigated that, but I know there's not that many donors around in Victoria, so we are limited. But there are other options if we don't find sperm, and sometimes
yeah,
when males present with no sperm coming out of their ejaculate, sometimes we can't find sperm, even though even in the capable hands of Dr. Katz, sometimes he still won't find sperm.
that's right.
And for those men, I think then we have to open up the whole donor sperm story with them. Yeah. Yeah.
I think what I was just saying there, Lynn, is I think I'd opened myself up to the options,
Yeah.
the availability of other options,
Yeah. Yeah.
and there are. So my outcome had changed to, well, it hadn't changed too much, but it had changed to the fact that I would have liked to have little ones running around.
Yeah.
That'd always be my own. And
Yeah.
prior to Laura, I'd already decided when I thought I couldn't have kids, I'd already started to work with kids and just decided that I'd take everyone else's and give them back at the end of the day.
Oh, that's a very nice thing to do. And
Yeah.
yeah, well, it's very sweet. And I think like with the testicular biopsy, there's 3 different types, isn't there? So there's the fine needle, which you had to start with,
Yeah.
and then
Yeah.
there's a small open, and then
Yeah.
the Micro-TESE, which you had. So the
Yeah.
fine needle is just a little needle into the testicle. The small open is just a little cut into the testicle, and the Micro-TESE is quite a big procedure, isn't it?
Yeah, yeah. Well, I do have to say, Lynn, that fine needle aspiration, it didn't feel like a fine needle, by the way. But
Were you awake during that?
I was awake, and it was actually they did 3 passes. So the first pass they didn't find any, second pass didn't find any, and then the third pass, the doc looked at me and just went, "Whoa, I couldn't do this." And I looked at him and went, "What are you talking about?" But yes, I was very grateful for that day. They found one anyway.
Rosie just said, "Ouch."
Yeah, yeah. I just saw that. But the Micro-TESE, that was I was lucky enough to be asleep for that, and lots of ice after that one.
Yeah, so I saw
Yeah,
someone
didn't so
actually.
much need pain relief, but
Yeah, I know that would have been very, very tender, particularly having 2 of them as well. Um,
yeah,
yeah, so overheating testicles, that's something else that, a lot of guys overheat their testicles. You put that on your post, like keep your testicles
yeah.
cool, fellas.
Keep your balls cool. Yeah,
Yeah, keep your balls cool. So that can help sperm production. Because if you're overheating the testicles, say if you've got excessive weight on, that can actually cause poor sperm production as well. So it's important if you are trying to have a baby to try and get your body as healthy as possible. So, losing weight if you need to lose weight, taking all the antioxidants that we described before. If you want the list of the ones I recommended, just email our clinic or we'll send you the list. I've got the list here, actually, the ones that we recommend. So, yeah, and clean up your lifestyle like you did, Jon,
yeah, yeah.
not everyone has to go vegan, but, clean out all the pesticides and the cleaning products at home. You can actually make a lot of your own cleaning products, like you said.
Yeah, that's right. That's right. And we were washing our fruit and vegetables as well,
Yeah.
endeavouring to get rid of like you said, the pesticides. So
I know Laura
yeah,
was
those
having.
changes.
Yeah, I know Laura
What was
was
that,
having a
sir?
green smoothie every day. What was in that
Yeah.
green smoothie?
Oh God. Well, mine was a little radical, but hers are a bit more simple. Though avocado and apple and cucumber, but she likes spinach and that sort of stuff. Whereas mine would be a real man smoothie, and you could pretty much chew on it and eat it with a spoon.
Ah, okay. What did you put in your smoothie?
I would put things like, so I'd have hemp seed in there. I'd put chia seeds, banana, apple, and did I say hemp seed? So I said hemp
Yeah.
seed.
Yeah.
Psyllium husk. Psyllium husk. I'd put
Okay.
psyllium husk in, and
Yeah.
I found a really good protein, a vegan protein. So it's more seeds that are ground up. And
Yeah.
yeah, it ends up quite a it ends up a thick smoothie anyway. So I could have it as a cereal type thing. Yeah.
And when did you and Laura begin your fertility journey? So when did you first start investing? Is that
So
like 3 years ago now?
Yeah, it would be. It's because we met 2017, so we
Right.
pretty much started on the journey straight away, and it takes a while to, like, you do all the paperwork and
Yeah.
counselling and things like that. So it
Yeah.
was a bit slow getting started, but once we sort of found our stride,
Yeah.
we sort of yeah, did all we can.
Yeah. Well, you
The
both
the
like,
the Micro-TESE was an interesting process though, and whilst now I've had two, my hormones have to be adjusted now. So for the rest of my life now, I'll be on hormone replacement therapy.
mm,
Um, but in saying that, I feel as normal as usual. So yeah.
yeah. Yeah. And how are you taking your hormone replacement therapy? Is that an injection or is that
Yeah,
orally?
yeah, it's an injection. It's an injection myself, and there's an oral. There's a couple of oral compounded medications. Yeah,
Yeah. And are you seeing an endocrinologist for that?
I'm seeing a doctor just up the road, actually, around the area, and
Yeah.
they're working on getting my hormones back to normal levels.
Yeah. Yeah. Fantastic. So what an amazing journey. And thank you so much for talking about your journey.
Yeah,
And very interesting your posts. And I think it's great to hear a guy's version of their fertility, because I think a lot of men feel a little bit left out. I think we concentrate on the women a lot and tend to leave the guys out.
yeah,
I think it's important to open up and talk about it. And things like getting your balls checked as well, to avoid testicular cancer, which is on the increase.
yeah,
Imagine if you left it another 6 months. So,
yeah,
you
yeah.
caught it before it spread. So I think if you notice a lump in your testicles or they're pain like John had, I think important to get to do an ultrasound. So you've
Yeah.
had an amazing journey, and for someone that thought he was never going to have a baby, to have a pregnancy now, that's so amazing. So congratulations to you and Laura.
Yeah. Yeah, thank you very much. Thank you very much. We appreciate all the well wishes, and it's just been fabulous. We've our initial thoughts, and I think we mentioned this to you, Lynn, in the beginning about men's infertility, and that we found that there wasn't. Well, I found there wasn't that much around. Just helping the guys through with their not only the sperm side of things, but their relationships and stuff. So we are going to endeavour to, I don't know, compile something, a book or whatever, about just our learnings, and see if we can't help out some more, and
Yeah.
just yeah,
Create awareness for male factor,
yep, 100%,
which
100%.
affects so many, and it's no need to be embarrassed about it or anything. It just sometimes we can't explain why the sperm's low,
Yeah,
or there's no sperm. Sometimes it's unexplained, but you don't need to be embarrassed about it or feel less manly because your sperm might be low. There's a lot of guys going,
if I can say
yeah,
If I can say one thing, Lynn, for the guys out there, your ladies' clocks are ticking. So
yeah,
for us, it's actually pretty simple to find out whether whether you have sperm or you don't, or whether you've got enough, or it's swimming backwards or forwards, or doing somersaults, whatever. Just go and see a doctor, get
yeah.
tested, and at least then you can move forward, and then you can work out what the next step is.
Yeah, exactly. So don't leave it, because I find that a lot of guys think that their partners are young, even when they're sort of,
Yeah.
37. Oh, we've still got time. When you hit 35, there's no time. So don't waste the eggs that are there, because after your 35th birthday for women, the eggs decline in quality and quantity. So don't leave it if you are struggling to get pregnant. Seek help after 6 months of trying, and make sure that everything's working. You might not need treatment at that point, but just make sure there is sperm and that your partner is ovulating.
I agree 100%.
Yeah. So, how many months are you guys? Someone asked the question. I don't know if you want to reveal that yet. I think Jon and Laura are keeping that a little bit secret for the moment.
Yeah, yeah, but we're this thing's happening, guys. I've got to chat to the missus about that one, I think.
Yeah, so we're keeping that one a little bit secret. And well, so thank you so much. I think it's been a great
Pleasure.
evening, and thanks for talking at my events as well, and providing information to the guys out there and to their partners. And yeah, don't forget, guys, to get checked out and look after your health.
Yeah.
Yeah.
Go for it, guys. Thanks for having me, Lynn.
Thanks, Jon. Say hi to Laura. Thanks.
Thank you.
Bye.
See you later.
Bye.